probably heard of a lot of doctors offering stem cells and a lot of different places talking about stem cells, but regenerative medicine really is this intersection of three things. It's cell therapy, gene therapy, and tissue engineering. And so combining these three things is really what we're trying to do. And by combining them, that's how we're able to get into this next era of medicine. So it's not just one or the other, it's really the combination that's what regenerative medicine is. And regenerative medicine is a new science, so because a lot of patients and a lot of people are looking for different places to go, they're trying to decide, should I go to this stem cell doctor? I think in general, if they're not involved in research, if they're not involved in clinical trials or in active research, you probably don't want to go to some offshore clinic in Colombia or something like that, just because there's lack of regulation and you don't always know what you're getting. And so because I'm in this world now, I'm trying to do it the right way, which is we're trying to do scientific research, but we're also offering solutions to patients who don't get help by our medical system, because there are a lot of patients who don't get help by the traditional system. So just on a brief note on that, there's a regulatory thing too, where you can do stem cells in certain countries. For example, in Denmark, you can only do autologous, which means you can do them from your own body, but you can't do them from allogenic, which means from donors. And donor stem cells from umbilical cord tissue are likely the best, but there's a lot of political reasons as to why they're not allowed in certain jurisdictions. But we do those stem cells in other countries. For example, we do them in Dubai, in Tokyo, in Japan. We have a clinic in Mexico, and then we also are opening one in Lithuania in Europe. So these are jurisdictions where we're allowed to do these technologies. And if you want to learn more about, the medical system and the politics behind it, I've done a lot of podcasts with different people and going into that, but I'm not going to go into all the details. But the gist of it is, unfortunately, you can't do a lot of these treatments in a lot of Western countries. And yeah, I think we all know our medical system has problems, and mainly because it's reactive and it's not really focused on treating the underlying cause. And I think in general, people here probably already know that. But the reason regenerative medicine is exciting is because it can actually reverse chronic disease, or better yet, it can even prevent it. And so that's why these technologies are becoming really interesting and becoming kind of at the forefront. Because imagine you go to your family doctor and you get these stem cells or you get these gene therapies and you go there every year, and then you keep yourself healthy in the first place and you don't get sick and you don't have these chronic diseases. Because what's breaking down the medical system? It's acute exacerbations of chronic medical diseases. So what that means is, like, if you have someone with like COPD or heart failure or diabetes, they get these exacerbations and then they have to be hospitalized. And a lot of them, it just ends up being like a revolving door. And that's what's putting so much strain on our medical system. And obviously most doctors are just too busy working and they can't take a step back and realize, like, okay, how do I actually fix this? So fortunately, I'm in a unique position where I have access to a lot of people globally, and we're trying to fix some of the systemic issues by doing research and by actually showing the world, hey, this stuff can actually treat previously thought incurable conditions, or conditions that we thought that we could only manage with drugs. So obviously aging is kind of the hot topic, and to understand stem cells, you first have to understand a little bit and why they're important for treating aging. First, you have to understand, why do we age in the first place? This could be a whole talk on its own, so I'll try to keep it as brief as possible. But basically, the root of aging really is accumulation of damage to your mitochondrial DNA and your nuclear DNA. So this is called genotoxicity, when your nuclear DNA accumulates damage. And then mitochondrial DNA, as you probably guys all know from high school biology, we were taught the mitochondria are like these little organelles that help with energy production. But it turns out they're a lot more than that. They're like little sensors, and they sense the environment. And they actually have like 10 or 11 different functions, including regulating apoptosis, which is like cellular death if the cell becomes senescent, iron metabolism, calcium, like all these different things that they do. And obviously that's where your body, when you consume food, your body has to go through the mitochondria for cellular metabolism to produce energy. And if your mitochondria aren't working properly, then guess what? Your body's going to start breaking down. And so there's a theory right now in aging saying the unitary theory of aging, which is the reason we believe we age is because our mitochondria stop working the way they should. And they also become damaged and they become less in number as we become older. And so there's actually interesting companies working on mitochondrial transplantation. That's one company we're talking to right now where they're actually looking into transplanting. They've already done it in animals successfully, but they want to do it in humans where we can transplant mitochondria from young people into elderly people. But the cool thing is stem cells, we'll talk about, they help to transfer mitochondrial DNA, and they actually help with mitophagy, which is repair of mitochondria, and that's why they help with aging. And then this hematopoietic system shift, this was published in Nature just this year, actually. But the gist of that is basically our bone marrow is where stem cells are made, and what happens over time as we age, we produce more pro-inflammatory cells. So a lot of you have probably heard of like inflammaging, but where does that actually come from? That comes from the bone marrow, because the bone marrow, where you have blood vessels, and you have this microenvironment that becomes aged, and that causes those cells that are being made in the bone marrow to express a pro-inflammatory phenotype. So what that means is basically you're producing more inflammatory cells instead of anti-inflammatory cells. And over time, this is what leads to a lot of aging and degeneration in the body. So yeah, so the goal is obviously tissue homeostasis, which is like how do we maintain a baseline, meaning how do we maintain our body to change as least over time as possible. Because our body is basically going through this entropy state where it's like over time there's more disorders, there's more change. And if you can maintain that homeostasis, then obviously you're going to have less damage and accumulation over time. And that's why these stem cells are so interesting, because they can help to reverse some of the damage and help to maintain that homeostatic state. So yeah, we talked a little bit about accumulating damage, but oxidative stress is probably one of the other. Mitochondrial dysfunction basically means that there's too many of these free radicals being produced. Just when you're hanging out here and you're just sitting, or even when you're sleeping, your cells are still working, right? So your cells never take a break. Unfortunately, your body is always doing something, and when it's doing something, there's byproducts. There's byproducts of cellular metabolism, and these byproducts think of them like toxic waste products that are being produced. And your body has a capability to deal with this, but over time, your body's capability to deal with this becomes less and less. And this is called oxidative stress, when these free radicals build up. And then when these free radicals build up, guess what? They start damaging your mitochondrial DNA. They start damaging your nuclear DNA. They start damaging your cell membranes, which is very important, because your cell membrane is like, think of it like the security system for your cells. And when they start getting damaged, this is called lipid perioxidation, which is a phospholipid bilayer, which is kind of like the gatekeeper for your cells. They start accumulating damage as well. And then because they're accumulating damage, stuff gets in the cell that shouldn't, and stuff gets out that shouldn't. And then so you start getting this dysregulatory cascade. And so oxidative stress, and that's why it comes back to this mitochondrial DNA, is the root cause of aging. And what can we do to prevent that, or what can we do to treat that, is really a hot area of research right now. And that's why one of the easiest tips and this was Gabrielle Lyon, who's a physician friend of mine, and we talk about this a lot. And one of the easiest things you can do is every meal that you have, just try to have some sort of food that has antioxidants in it, just like polyphenols with every meal. And supplements is a whole other kind of, let's say, more controversial thing, but whole foods, you can never go wrong with polyphenols, dark chocolate, stuff like that. But stem cells, they help your body's ability to deal with this oxidative stress as well. So we'll talk about how. So I like this analogy of like your body is like a city. And I was coming back, I was kind of talking about that a little bit. And so it's a good analogy, because what happens, if you think about it, like you have these buildings which are cells in your body, and you have trillions of buildings, and every day there's some being demolished and new buildings are being put up. This is the process of cell cycles. For example, your skin goes through, it's a 27-day cycle. So if you want your skin to stay youthful, your stem cells that are going to take over that new skin cell over 27 days better be in good health, so that when you get those new skin cells, that they're like the ones you had before. But over time, there's this damage that happens. So how do we prevent that damage from accumulating? And there's a lot of details here in terms of I could spend a whole hour talking about this, but since I only have 30 minutes, I'm going to have to be brief. But basically the gist of it is we talked about the oxidative stress. The other thing is these other big things to understand is something called macrophages. Macrophages are white blood cells in your body, and their job is to go. They're like patrol officers, so they go around and figure out who the bad guys are, and they catch them or they actually eat them. And what happens over time is just like a lot of police officers, they kind of become fat and lazy. And so they actually eat too many donuts, and they just don't do their job anymore. So this is actually a medical term. This is called lipid accumulated macrophages. LAMs is the medical term. So lipids meaning fat. They're accumulating fat, and then they can't do their job anymore. So which means they can't get rid of the cells that are damaged, and then that's why you start getting these senescent cells that are hanging around, and then just how the cell dies is so important too. So for example, I put on here about, don't demolish versus demolish me. So these are signals that your cell says, hey, I'm ready to be taken away by the body and I need to be cleared out. But if your cell doesn't go through a proper process of dying, then these signals aren't sent, and then that's why you get senescent cells. So this is actually called preoptosis. We talked about apoptosis, which is like programmed cell death, but preoptosis is cell death due to too much inflammation. And then there's also something called necroptosis and ferroptosis, which relates to iron metabolism. But the point is, there's different ways your cells can die, and if they don't die in the right way, then that can lead to more issues. And so how do you get them to go in this kind of like orchestra where it's like these cells are dying and these new ones are being renewed? And a lot of that comes back down to the signaling cascade from the mitochondria and the nuclear DNA that we're talking about with oxidative stress. And that's why, I mean, I keep coming back to oxidative stress, but it relates to every chronic disease. Like even if you take heart disease, for example, cholesterol isn't necessarily the bad guy, right? LDL. Why does LDL become sticky, and why does it actually get stuck? It's because it gets oxidized, and then that's what causes it to get stuck in the blood vessel. So that's just like an example to give you why this stuff is so important, because a lot of times we're chasing these superficial things, but we're not looking at the deeper cause as to why this happens in the first place. So now, obviously my title was called stem cells, but obviously I talked, there's a lot more than just stem cells. There's regenerative medicine's a big umbrella. And I think, with stem cells, I want to obviously go into details as to why that helps with aging and why we're so excited about it. So there's different things that we can transplant into your body, okay? So we can transplant stem cells, right? Cell therapy. We can transplant new genes. We can transplant, we're talking about mitochondria that's being worked on, exosomes, and then we can also transplant different type of cell therapies like natural killer cells, dendritic cells, which are for immunotherapy to help with cancer. And then we can also transplant new microbes. So you can transplant, it's called fecal microbial transplant, which is where you're transplanting new microbes which change the gut microbiome. So it's like you're actually rebuilding a new body almost. That's what regenerative medicine is. And that's why it's so exciting, because this is actually happening now. We actually have clinics, we're actually doing this. It's not just like basic science anymore. And over the next 20 years, this is going to just take off even more and more, and the kind of clinical translation of this will become more and more sophisticated. So the biggest problem with stem cells, the number one problem has always been lack of standardization, which means that you don't have a standardized cell product. So if you go to some stem cell clinic in Denmark right now or in the US and they're taking your own stem cells, the problem is your stem cells are going to be very different from my stem cells, and they're going to have different profile. That means there's different signaling cells in there. There's different anti-inflammatory growth factors in there, and so you don't have a standardized product. So you're getting a lot of variability in terms of what the outcomes are going to be, because you can't standardize it. And so that's always been the problem with stem cells. And then the other big problem with stem cells has been getting the cells to actually survive. That means if you take umbilical cord stem cells, if you go to any other stem cell clinic in the world right now and they're doing umbilical cord stem cells or they're doing fat stem cells, they say cell viability is like 95 to 99%, which means in a test tube. But when they put them in your body, this is a scientific fact, not over 90% of them die. And then if you put them in a large weight-bearing joint, for example, into a knee or a hip, within 2 hours, only 14% of the cells are still there. And within 24 hours, only 2% of the cells are there. So that means most of the cells don't even stay there. And so even with this, you still get, you still see these, online clinics and marketing and all that stuff, and you still see people get successful results. And that's with the old generation technology. But imagine if you could actually make the stem cells survive, and imagine if you could actually make the stem cells stay where we want to. So we've overcome both these problems, and I'll explain how. So number one, I was in Japan this summer. I spent the summer in Japan for about 2 months. Japan's the best place on earth, if you don't know. It's mainly because of the sushi and Kobe beef, but also just because their stem cell technology, they actually got the Nobel Prize. There's a guy named Professor Yamanaka who got the Nobel Prize in regenerative medicine in 2014. And so it kind of put Japan on the pedestal on the global map, because it was like, okay, Japan's obviously doing some cutting-edge research and cutting-edge work. And so the Japanese government put $8 billion of taxpayer money into regenerative medicine. So they're really big on pushing regenerative medicine forward. They have lobbyists. They're actually trying to push this to take over, just pharmaceutical and surgical industries. And so because of that, they have a huge incentive for regenerative medicine to actually take off. And so Professor Yamanaka discovered something called iPSC cells, induced pluripotent stem cells. So this was a discovery where he could overexpress these 4 transcription factors called pluripotent genes, and he could make old cells young again. So it sounds kind of like sci-fi. It's like, how do you make something that's old young again? So it was actually a really big breakthrough, but the problem was these cells could turn into tumor or cancer. So the clinical translation of them never really took off, and we're still not there. We're getting close. But around 2008, there was another scientist, Professor Dezawa, who discovered something called MUSE cells. This is multi-lineage differentiating stress-enduring cells. MUSE, M-U-S-E. I know it's a mouthful. You don't have to remember it, but what that means is these are cells inherently in your body. We all have MUSE cells. They're floating around right now. They're a subpopulation of stem cells that help to repair and fix damaged tissue. That's their job. That's what they do. But the problem is, as we get older, we have less MUSE cells, and their ability to do their job becomes less and less. This is called stem cell exhaustion. This is one of the hallmarks of aging, and arguably top 3 reasons as to why we age, up there with oxidative stress and inflammation. And so if you can keep your stem cell supply not only higher in number, but give your body more of these MUSE cells to repair, don't you think that would help your body? Right? And then so clinically, she's done many clinical trials in Japan between 2010 to 2020 for like ALS and stroke and these really difficult to treat conditions. And she showed that these MUSE cells, when they're taken from donors, they're perfectly safe, they're hypoimmune, they're privileged, which means your body doesn't reject them, and they're able to repair tissue in the brain. They have this amazing homing mechanism, which means when your body has damage, they actually go there and they help to repair things. So it's a pretty big breakthrough in regenerative medicine, and it just never got the press it should have. But MUSE cells are these amazing little guys in our body that we're now able to isolate from umbilical cord tissue, and we're able to infuse them back into your body, and we're able to inject them. And the cool thing about MUSE cells, as I was saying, is that they're stress enduring. So that's what the name stands for. Stress enduring means they survive when they go in the body. So they're not going to die like traditional stem cells. So that's the big difference. And then the other thing is we're putting them into these hydrogel scaffolds. So hydrogel is basically like collagen or hyaluronic acid. Think of it like Jell-O. And it protects the stem cells and allows them to stay where they're supposed to stay. So when we do injections into the joints, we're combining them with the hydrogel, and then the stem cells actually stay there. And then you actually get regeneration of cartilage, and then you can actually repair and fix damaged tissue. So that's why this stuff is becoming exciting, because now we're in this next generation of stem cell technology, as opposed to just saying, okay, let's just take some stem cells and put them in your body and hopefully they work. Because that's kind of where we were for the last 20 years. But now we're moving on to this next generation technology. And then the gene therapy, I just want to quickly touch on this, but again, this is a big topic, but there's CRISPR, which is kind of like, cutting out your DNA and changing it. We're using something called a plasmid, which is derived from E. coli. We have the world's first plasmid gene therapy, which is basically, it's a vector for us to introduce a gene of interest to your body. And the first product that we have is called follistatin. And if you read about follistatin, it's this amazing peptide that's in your body. It's bioidentical. And what it does is it basically helps to increase your muscle mass, and it slows down aging. So it has all these benefits for strength and energy and slowing and decreasing inflammation. And we did a phase 1 trial, but we're doing phase 2 soon. And then and then hopefully eventually it'll be covered I mean, this will probably take like 5 to 10 years, but eventually we're hoping it'll be covered by insurance companies for sarcopenia, which is muscle wasting. But it is available for people who are more like longevity enthusiasts right now, I would say. But it's still early days, but definitely this is going to be something that's you guys will probably see more and more traction of over time. Exosomes is something that probably a lot of people have heard about because they get talked about more, but exosomes are basically the byproduct of when stem cells are replicating and growing. There's this soup that they grow in, and that soup, it has all the nutrients in there, and then that soup is basically the microRNAs, the proteins, the growth factors. So there's no cells in there, but the exosomes the good thing about exosomes, because there's no cells, theoretically there's less risk of reactions or anything like that. So they're very safe, and the good thing about exosomes too is they're very easy to isolate. And so there's a lot of clinics doing them all over the world really now. But again, the problem is lack of quality and standardization. So where are the exosomes coming from, and how are you characterizing their profile of what's in them? And because exosomes don't have the cells, they're only there for minutes to hours. So your body clears them out pretty quickly. So you need frequent dosing, but then they can still yield really good results for longevity and cosmetics and a whole lot of other things. And then I think, so I know I wanted to save some time for questions. How much time do we have left? 6 minutes? 7 minutes. Yeah, okay. So, I mean, I could talk all day about this, but I figured there's a lot of information here. So, and I know I covered a lot in a short amount of time. So, I figured I would save a little bit of time for questions. But the cool thing, as you guys understand now, is now you understand why does the body age? It's because the mitochondrial DNA, the nuclear DNA is getting damaged. These stem cells, especially these MUSE cells, we're able to isolate them, put them in the body, and they're able to repair this damage. They're able to give your body new mitochondrial DNA. They're able to do mitophagy, which repairs damaged mitochondria. So they actually have real clinical anti-aging benefits. Like we actually see patients who say, I feel 10, 15 years younger. And now we can actually measure this too. There's a company called Generation Lab that measures something called biological noise, which is the amount of damage, and it's kind of the amount of damage that your genes accumulate over time. And they can measure this. And so we can say, hey, before you did this treatment, this is how fast you were aging. And now after you did this treatment, this is how fast you're aging. So you slowed down aging by this much. So it's cool. So then you have some objective evidence to say that you're actually getting better and you're actually slowing down aging. So there's something happening internally. And then you also see the subjective benefits, of course, of people saying that they have more energy, vitality, and all of that. So yeah, so I'll stop there because I think there's a lot of information, and I just wanted to leave it open if people have any questions.
Super. Thank you so much.
You.
Yeah, I don't.
Also very hot.
Do anyone have some questions? Yep, already there? Yeah.
Hi, I was just wondering, your clinic specifically at Eterna, do you help women that want to have stem cell from their own umbilical cord? Meaning,
yes, we can. Yes, if you don't, you can donate. We have if you're our patient, we have a factory. We have our own manufacturing facility, so we can basically ship it there, and then we can isolate the MUSE cells from your own umbilical cord tissue.
Okay, that's good.
Other questions? Yeah, we have one over here, and 2, and 3.
Hey, thanks so much for the talk. It was super exciting.
Brian's shirt.
Oh, yeah.
He did the follistatin with us. He did a video of it, but anyway, yeah.
I saw it then. I was wondering, if we want to get as smart as you on these topics, like how can you recommend to learn more, especially if we didn't go to medical school?
I've done a lot of podcasts. So that is like, now tens of hours of, I guess, content, but also the regenerative medicine. I mean, you're right. There isn't like a great area. A lot of it, the way I learned, was traveling around the world and putting it all together. But I would say probably the best resource on this is honestly the actual scientists, because they're not the ones who are out there and talking as much about it. But if you really want to get into the weeds, check out, there's something called the Stem Cell Podcast and the Immunology Podcast. They're really dense scientifically, but that's where you would really learn about the science.
Actually, it was the one here in the white shirt. Yeah.
Thank you. I followed you since you've been treating his name Big Ramy.
Bodybuilder. Yeah.
Bodybuilder. I have a question about autoimmune disease.
Yeah.
do the stem cells treat that like alopecia? And,
yeah, because what these cells do is there's a lot to talk about here, but basically one of the mechanisms by which they work is immunomodulation, which means they help to reprogram your immune system. So they take it from a pro-inflammatory state to an anti-inflammatory state, and they increase something called T-regulatory cells. And basically, you can put patients into remission. The only thing we don't know is dosing. So there's some patients I've had who've done like one infusion, and I've been able to get their rheumatoid arthritis into remission, and the other ones who need like 2 or 3 or multiple infusions to get there. But we combine them with peptides and bioregulators, and we're able to achieve great results for autoimmune conditions.
Okay, thank you.
Thank you so much. It works pretty well in psoriasis, actually, too. There are Japanese studies on psoriasis, which improve dramatically. Yeah. But as I told you before, I had some experience with perinatal cells and stem cells from umbilical cord and placenta. And my question is, you probably know about the results from Kurzberg in cerebral palsy and neurodegenerative disease in children, in young children. And coming back, what you said, that 90% of the stem cells would die. In these studies, when the children get autologous stem cells infused, do you think when they accumulate in the brain that still 80% of the cells there will die, or do you think in these studies that?
Yeah, no, and that's the cool thing. I mean, the reality is most of the cells are still dying or getting trapped in the lungs, but even with that, you still see some decent results, right? You still saw them in the clinical work that they've done for cerebral palsy. So imagine if you have cells that actually survive, and the good thing about the MUSE cells is they actually cross the blood-brain barrier as well, whereas regular stem cells, most of them just get trapped in the lungs. So we have a pediatrician on our team, and we've been using it for cerebral palsy and autism, and I mean the results have been really, really good. Yeah.
We have time for one more question. The lucky one, in the back row. Thank you so much to take your time for.
Oh yeah,
the
no worries. Yeah.
Well,
I figured it would. Yeah. It's a lot of information.
Exactly.
I thank you very much for your talk and your presentation. I literally have 2 questions. First one is, you ever combined stem cells with light therapy?
Yes, they used to do that early in their early studies too, because they were trying to get the stem cells to go where they wanted to. So they would use photobiomodulation or light therapy to kind of get them to go. But now that we have the MUSE cells, they have this really strong homing mechanism. So we don't really use it in the procedure anymore, but we will recommend it like after the procedure because it can reduce, it can still be adjunctive.
But it's not only for finding the targets, also for proliferation purposes, maybe.
Yes, exactly. Yes,
so
exactly.
You ever tried combining MUSE cells with?
I haven't, just because the results with the MUSE cells have been very good without it. So
And my second one, you ever heard of V cells, and what are your thoughts about?
Yes, V cells. Unfortunately, I don't think they're not. They don't really have the same science as MUSE cells, and they don't have that same inherent property to survive and homing mechanism and all that. So I think MUSE cells are definitely a lot better than V cells.
Okay, thank you very much.
Yeah. I think we could go on and on here, but time is running up. So thank you very much for joining us here.
Yes, thank you. Thank you.